Hello. My name is Jones, and today we are going to look at electroconvulsive therapy. Okay, so within this definition, or within this discussion, we are going to look at the definition of ECT, which is the short form for electroconvulsive therapy. We are going to look at types of ECT. We will look at indications for ECT. We are going to explain the contraindications for ECT. We will state 5 side effects of ECT, or we are going to state some of the side effects of ECT. We are going to explain the law of the nurse during ECT, and in explaining the law of the nurse, we'll look at it in terms of before electroconvulsive therapy or ECT, during ECT, and post procedure or after the procedure. So these are the objective of this lesson as we look at electroconvulsive therapy. Okay, so electroconvulsive therapy is prescribed in a lot of conditions, and it is discussed in mental health. So that is the reason why we are looking at it in this way or in this fashion, and we want to achieve these objectives. So what is ECT, or how can you define electroconvulsive therapy? So electroconvulsive therapy is the artificial induction of a grand mal seizure through application of electrical current to the brain. Electricity, convulsive convulsion therapy. So electroconvulsive therapy is the artificial induction of a grand mal seizure through application of electrical current to the brain. Okay, the stimulus being the electricity that is applied through electrodes that are placed either bilaterally in the frontal temporal region or unilaterally on non-dominant sides. Okay, so electricity or some amount of voltage of electricity is passed through the brain to induce induction, to induce a grand mal seizure with the motive of controlling the electron transfer within the central nervous system in order to balance or bring about homeostasis in the electron transfer within the brain, in order to bring about biochemistry or biochemical balance within the brain. So it's a therapy where electricity is induced through the brain, so that you can bring about a grand mal seizure and bring about a balance in the electroconduction system within the brain. The parameter of electrical current that is applied, or the dosage, okay, that is applied, is 70 to 120 volts. And it's for the duration of 0.7 to 1.5 seconds. Of course, this is an extract from the American Psychiatry Association of 1978. So the parameters of electrical current that is applied, or the dosage, standard dose of electrical current that is passed in electroconvulsive therapy, is 70 to 120 volts. Then the duration is 0.7 to 1.5 seconds. Okay, that is between that period of time. Okay, then types of ECT, or types of electroconvulsive therapy that are there. There is direct ECT and there is modified ECT. Okay, so by direct ECT, this is given in the absence of anesthesia and muscular relaxation drugs. Okay, but you also need to know that at the moment, or in the standard practice at the moment, the direct ECT is not commonly used method as of now. So direct therapy, here you do not administer anesthesia and muscular relaxation drugs. Okay, then the other type is modified ECT, which is the complete opposite of direct ECT. So in a modified ECT, drugs that induce muscular relaxation and general anesthesia will be applied. Okay, so in modified ECT, muscular relaxant and general anesthesia is applied. So these are the two main types of electroconvulsive therapy. Okay, so what are some of the indications for ECT? So ECT has some of the conditions where it can be applied, but clinical practice may determine otherwise. So the indications for ECT may include major depression, especially where there is some suicidal risk. The other indication can be severe catatonia. The other indication can be severe psychosis, like in mania. Severe psychosis, like mania. Then the other indication that we can talk about is organic mental disorders. We have covered separately all these conditions. You can always try to look through our channel and find the discussion on major depression, severe catatonia, severe psychosis, or organic mental disorders. So these are the indications for ECT. So depression, mania, catatonia, or organic mental disorders. Okay, so now we also have some contraindications for ECT. We have some contraindications for ECT, and I'll categorize these as absolute and relative. So, an example of an absolute contraindication for electroconvulsive therapy is raised intracranial pressure. Raised ICP is an absolute contraindication for ECT. Then there are relative contraindications for ECT. So some of the relative contraindications for ECT that you can look out for include cerebral aneurysm, cerebral hemorrhage, brain tumor, acute myocardial infarction, or retinal detachment. So these are relative in that depending on the situation, the practitioner may decide to use ECT. But when it is absolute, you do not use because you worsen the condition to the complication of death. What are some of the side effects of ECT? What are some of the side effects of electroconvulsive therapy? The induction of electricity in the brain so that you induce a grand mal seizure or convulsion to control electroconduction system within the brain. So what would be the side effects of ECT? So one of them is memory impairment. Okay, so there might be some momentary memory loss after the induction of ECT. Other side effects include drowsiness, confusion, or restlessness. After you induce or after induction of ECT, the patient may feel drowsy, may feel tired, may feel a little bit confused, or may show restlessness. Then the other side effect of ECT is poor concentration and anxiety. These can be seen after administration of ECT. Other side effects that you need to look out for include headache, dryness of the mouth, unsteady gaits, or tongue bites, which may happen as the ECT is being administered. And also because we also give muscle relaxant, and also the act of convulsion may result in incontinence. So some of the side effects may also include incontinence. ECT affects the cardiovascular system as it brings about heart palpitation. It may affect the GIT, that's a gastrointestinal system, as it may bring about nausea and vomiting. Okay, so after ECT, the patient necessarily feels weak from the grand mal seizure that they necessarily experience, and this may also bring about backache, okay, and muscle aches. So these can also be considered as some of the side effects of ECT. Okay, so let us now appreciate the roles of a nurse, that is before ECT, during ECT, and after ECT. So ECT is the therapy or the treatment. So the role of the nurse: pre-treatment evaluations have to be undertaken. So the role of the nurse before ECT is conducted is to conduct pre-treatment evaluation. Some of the pre-treatment evaluation include detailed medical and psychiatry history, including history of allergies. This may help you determine if they can be allergic to some general anesthesia and help you to come up with a different cocktail of drug choice. The other pre-treatment evaluation that the nurse can do before ECT is getting a consent. You can allay any unfounded fears and anxiety regarding the procedure, but conducting this procedure requires that you get a consent. A consent is gotten from those that are 18 years and above, or it can depend according to your country or the policy of who is an adult who can sign the consent or not. Okay, then the other pre-treatment evaluation that can be done is withholding night doses of drugs. Okay, night doses of drugs that increase seizure thresholds like diazepam, barbiturates, and convulsants. So the nurse has this pre-treatment evaluation of withholding night doses of drugs that increase seizure threshold. Then the other pre-treatment evaluation that the nurse can do is withholding oral medication as the procedure is about to be done. This is to prevent regurgitation of the drug as ECT is being administered. Head shampooing in the morning can be done since oil can cause impedance of passage of electricity to the brain. Oil may increase the likability of transmission of electricity, predisposing the patient to bends. So, head shampooing may help to reduce the oil, okay, that may bring about or that may predispose to bends. Then the other pre-treatment evaluation has to do with any jewelry, prosthesis, dentures, contact lens, metallic objects, and tight clothing. These should be removed from the patient's body before the procedure. Then the patient also should have an empty bladder. So the pre-treatment evaluation is that you need to ask the patient to void. Then to dry gastrointestinal secretions, you will administer 0.5 or 0.6 milligrams of atropine, that is IM 30 minutes before the procedure. Okay, so atropine can be administered intramuscularly or intravascular before the procedure. This is to help dry secretions. So when you look at the pre-treatment evaluation of ECT, it is similar to the pre-op care, like someone who is about to go for an operation in theater. So starving of the patient 4 to 6 hours prior to ECT. These are some of the things that we do before someone goes to theater the next day or in the next 6 or 8 hours. So the role of the nurse in ECT before the procedure is more like the pre-op care before one goes to theater. So the points discussed herein are some of the pre-treatment evaluation that can be done. Then we can also discuss the role of the nurse intra-procedure or intra-procedurally. The role of the nurse during ECT administration. So the nurse can press the patient comfortably on the ECT table in supine position. Can also assist in administering of anesthetic agents like thiopentosodium and muscle relaxant, succinylcholine can be administered. So the role of the nurse is to administer anesthesia and administer muscle relaxant. So here we are doing the modified ECT. Since the muscle relaxant paralyzes all muscles, including those of the respiratory muscles, patient airway should be ensured and ventilator support should be started. You are going to have likelihood of poor oxygen saturation because of depressed respiratory muscle. Hence, you need to administer oxygen. The other intra-procedure care that a nurse can do is provide a mouth gag. This is in order to prevent possible tongue bites. Okay, so the nurse's role here is to prevent tongue bites, so they will apply a mouth gag. Okay, so concerning the placing of electrodes, the area where electrodes will be placed should be cleaned with normal saline or 25% bicarbonate solution. Okay, then apply a conducting gel. Okay, so the role of the nurse intra-procedure is to clean the area where the electrodes will be applied with normal saline or 25% bicarbonate solution, and then apply a conducting gel where the electrodes will be applied. The patient is likely to be connected to the ECT machine, but there will be also other machines around that the nurse can monitor to ensure that the effective dosage is applied, patient safety has been ensured. So the nurse will monitor that the dosage is within the recommended dosage that we have mentioned here in. So should look at also the intensity and the duration of the electrical stimulus that has been given. Look at the intensity of the convulsions that the patient experiences during the administration of the ECT. So the nurse will also ensure that oxygen is administered throughout the procedure, as convulsions compromises exchange within the lungs. Okay, so the nurse is going to monitor that oxygen is administered. Okay, then the nurse is going to monitor vitals during seizure, and also they are also going to monitor the electrocardiogram, the heart's performance using the electrocardiogram. Okay, because patients may be at risk of heart palpitations, or ECT may affect the electrical conduction system within the heart. So you monitor the heart electrical conduction system through use of electrocardiogram. You can monitor if you have connected oxygen pulsometer. You monitor oxygen saturation, and also you can monitor the brain electrical conduction system using EEG, encephalogram. So electrical encephalogram, so you monitor the brain electrical activities. So whichever machines that you have around here, as a nurse, it's your duty to monitor that the parameters recorded are within the required normal range or normal ranges, so that in case of any deviation from normal, necessary interventions can be instituted. During the procedure, the nurse can also record the findings and the medicines that have been given in the patient's chart. So nurses administers the drug and records the findings. Alright, so during the procedure, these are some of the elements necessarily that we can talk about. And when you look at this, these are some of the things that are happening during, that is intraoperatively, like when you're doing an operation, surgical operation, so intraoperatively. So most of these things are done. So when you're talking about ECT, you can always relate to necessarily things that happen intraoperatively. Okay, then postoperatively, that is after post-procedure. Okay, postoperatively, post-procedure, what are some of the roles of the nurse? So after the procedure, the nurse continues to monitor the vital signs. The nurse continues to monitor oxygenation till spontaneous breathing or respiration has started. So the nurse needs to monitor this. Then the nurse can assess for post-ictal confusion and restlessness that accompanies this procedure, or that mostly is seen after this procedure. Okay, so you can take safety precautions to prevent injury, sidelining position, and suctioning to prevent aspiration of secretion. Also, use of side rails to prevent falls is encouraged to prevent injuries to the patient. If there is post-ictal confusion and restlessness, diazepam may be administered to calm the patient. And then for some memory loss that may happen after the procedure, the nurse has the role of reorienting the patient in order to promote recovery or until the patient is fully oriented. When you have done all these post-procedure care, you have to remember that documentation is also your role as a nurse of all findings that are relevant to do with the patient's records or patient's behavior after the procedure. So after the procedure is done, okay, you have to appreciate that you may have 6 to about 12 episodes or administration of ECT spreads in different days of the week. Okay, spreads different days per week. So this will happen. So you have to document the findings and document your observation to see if patient is responding to treatment. So there you have it. We have recorded another lesson on electroconvulsive therapy. You can also refer to it because maybe some points that we have discussed here might not be part of the discussion of the points that we discussed in the other lesson on electroconvulsive therapy. Within this lesson, our objective was to define ECT, state types of ECT, list indications of ECT, explain the contraindications of ECT, and state side effects of ECT, explaining the role of the nurse during ECT, and also within these roles we looked at them in the fashion of pre-treatment evaluation or before ECT, intra-procedure care or during ECT, and post-procedure care. Okay, so that's how we looked at this. How did we define ECT? We defined ECT as the artificial induction of grand mal seizure through application of electrical current to the brain. The parameter or the dosage, okay, based on the American Psychiatry Association 1978, the voltage dose that can be given is 70 to 120 volts, and it should be for duration of 0.7 to 1.5 seconds. Types of ECT, we discussed that there is direct ECT and modified ECT. Indications for ECT: major depression, mania, and other conditions. Then contraindication, mostly for the absolute, is raised ECP or intracranial pressure. Then we have relative contraindications that included brain tumor. Okay, then side effects of ECT may include some temporal memory impairment, drowsiness, poor concentration, unsteady gait, and tongue bites. Then the roles of NS, we discussed this under pre-treatment evaluation. Under pre-treatment evaluation, you ensure that the patient's nail beds, if let's say patient is female and they have painted, you remove those paints that they use on their nails for easy observation, as patient is at risk of poor oxygen saturation. So you use these parameters for monitoring. Then remove dentures and other metallic objects to prevent electrocution, and the dentures, those in the mouth, they can dislodge and cause other problems or dislodgement. Intra-operatively or intra-procedure, we talked about the roles of NS there, and then we looked at the post-procedure care. So from me, I'm saying thank you and keep studying.